Chapter 18 Cardiac Disorders in Pediatrics. First, we'll be looking at recent developments, and then we'll be looking at epidemiology. So, first, recent developments in pediatric cardiac diseases are lesions are being increasingly identified on antenatal ultrasound screening. Most lesions are diagnosed by echocardiography, the mainstay of diagnostic imaging. Magnetic resonance imaging allows three-dimensional reconstruction of complex cardiac disorders, assessment of hemodynamics and flow patterns, and assists interventional cardiology, reducing the need for cardiac catheterization. Most defects can be corrected by definitive surgery at the initial operation. An increasing number of defects, 60%, are treated non-invasively, for example, persistent ductus arteriosus. New therapies are available to treat pulmonary hypertension and delay transplantation. The overall infant cardiac surgical mortality has been reduced from approximately 20% in 1970 to 1.8% in 2016. Now we'll be looking at epidemiology of cardiac disorders in pediatrics. Epidemiology. Heart disease in children is mostly congenital. It is the most common single group of structural malformations in infants. 8 per 1,000 live-born infants have significant cardiac malformations, 30% of which require intervention in the first year of life. Some abnormality of the cardiovascular system, for example, a bicuspid aortic valve, is present in 1 to 2% of live births. About 1 in 10 stillborn infants have a cardiac anomaly. The 9 most common anomalies account for 80% of all lesions, but about 10 to 15% have complex lesions with more than one cardiac abnormality, and about 10 to 15% also have a non-cardiac abnormality. Box 18.1 shows the most common congenital heart lesions. So congenital heart lesions are divided into left to right shunts, right to left shunts, common mixing, outflow obstruction in a well child, or outflow obstruction in a sick neonate. So left to right shunts, patients usually present breathless because left side of the heart, congestion on the right side of the heart causes congestion in the lungs, which causes breathlessness. So these include VSD, ventricular septal defect, which accounts for 30% of cases, persistent arterial duct, which accounts for 12% of cases, atrial septal defect, which accounts for 7% of cases. Next, we'll be looking at right to left shunts. These patients usually present blue. This includes tetralogy of Fallot, 5%, and transposition of great arteries, which accounts for another 5%. Next, we'll be looking at common mixing, which usually presents breathless and blue. This includes complete atrioventricular septal defect, which accounts for 2% of cases. Outflow obstruction in a well child usually presents with asymptomatic with a murmur. This includes pulmonary stenosis, which accounts for 77% of cases, and aortic stenosis, which accounts for 5% of cases. And lastly, you have outflow obstruction in a sick neonate. Usually they present collapsed with shock. And this includes coarctation of the aorta, which accounts for 5% of cases.